Hello, my name is Amy Leiker. I'm a student at University of Texas at Arlington in the Nurse Educator program. I will be discussing debriefing and nursing as an active teaching strategy, as well as demonstrating how it can be performed following a scenario simulation of an event. I have Carrie and Corleen here. They are second-year nursing students who will be beginning a clinical rotation through several acute hospital settings this semester and will benefit from the debriefing learning strategy as it is mostly used in the clinical setting. Debriefing is necessary for the reinforcement of classroom learning and facilitates active learning by encouraging dialogue and reflection. Engaging students in debriefing allows students to reference real-life experiences, make sense of their behaviors, and acknowledge their emotions. The first objectives for the students is to utilize classroom theory by actively participating in the scenario simulation, drawing upon knowledge learned in the classroom as well as experiences. The second objective for the student is to be engaged in meaningful dialogue, followed by scenario simulation to decipher further expectations or potential areas of improvement, including gaps in knowledge. The following demonstration will be an instructor-guided debriefing after the conclusion of a scenario with simulation by second-year nursing students on a trauma patient with multiple rib fractures that was having respiratory distress upon assessment. The debriefing tool, eChats, was used as a framework in guiding the debriefing session. All right, we will go ahead and begin our debriefing. All right. Okay, so following this scenario simulation, how do you guys feel that everything went, and how did it make you feel?
I felt anxious upon entering the room and seeing the patient only had 84% oxygen levels, and I had a hard time gathering my thoughts on what to do next.
I felt nervous but confident in how the scenario was handled.
Yeah, feeling anxious and nervous in a critical situation is completely normal for most nurses. Things that went well, and anything that you would do differently next time.
Initially recognizing the main problem and placing the patient on oxygen immediately was a positive. When the patient's oxygen level was not getting better, I was not sure what to do next.
After the patient was stabilized back to baseline, we could have been thinking of reasons for the decline in respiratory status, as well as to prevent the event from happening again.
Yeah. What would some factors that you could think of that could be causing the respiratory decline, and also some strategies to prevent it in a similar situation?
The patient had multiple rib fractures.
Yeah, and he had not been using his instructed tools to help open and clear his airway, such as deep breathing and therapeutic coughing.
Yeah, those are great. Anything else? Would mobility have a factor in his respiratory status, seeing that he has not yet mobilized out of the bed?
Yeah, mobility can be considered a factor in negative patient outcomes.
Perfect. Yeah, thank you both. You did a great job. On the simulation, and together you guys were able to bring him back to baseline. Let's look at the whole picture and review the actions that should have been taken during the scenario simulation. Looking at this particular situation, an appropriate course of action would be to see that the patient needed more oxygen immediately. Yeah. You both did it very well. You recognized his nasal canyon was laying on the bed. You put it back on him right away. After his oxygen did not come up to a desired level, respiratory should be paged immediately, and a different mode of oxygenation should be provided at that time. You can also consider the patient's position in the bed, and can be adjusted as tolerated. He may need his head up, he may need pulled up in the bed. Also, assessing his lungs adequately and instructing him through cough and deep breathing techniques, as long as incentive spirometer, especially since he was diagnosed with rib fractures. Also, percussion vibration may be a treatment needed to get him cleared out and breathing better. Once he's back to baseline, we should definitely educate the patient on the importance of mobility, cough and deep breathing, and incentive spirometry techniques. All right, let's look at some important takeaway points that you guys could utilize in further clinical situations.
Correct assessment of the patient's respiratory status and auscultation of the lungs. Looking beyond the obvious and thinking through a situation.
Knowing the patient's history and background in order to properly assess the situation, and adequate patient teaching to ensure the patient is doing what they can to progress.
Those are great. Those are great takeaway points. that can assist you in the future with clinicals and future simulations. I hope you enjoyed the presentation. Debriefing is an effective, active teaching strategy that can engage students in detailed conversations, helping to promote clinical thinking and improve students' cognitive skills, all attributes needed for today's acute care nurse.